Wow.
Good morning, good afternoon, good evening to you all, wherever you are in the world. Welcome to this week's edition of the M&E Thursday Talks on DME for Peace, just in case you've forgotten. And for those of you that are new to the Thursday Talks, my name is Jack Farrell, and I am the DME for Peace project manager at Search for Common Ground, based here in London in the United Kingdom. Today, I am delighted to welcome Dr. Luc Barriere-Constantin, Rituu B, Nanda, and Dr. Jean-Louis Lamboray of The Constellation. And they are going to lead a discussion on self-assessment, local response to global challenges. Just a note, if you have a question during today's webinar, you can write it on the question function on your GoToWebinar dashboard, and we will address it once we reach the discussion portion of today's webinar. I'm now going to hand over to today's guests, Luc, Rituu, Jean-Louis. It is wonderful to have you on the Thursday Talks. I'm really excited for today's discussion. Please feel free to kick off your presentation when you're ready.
Thank you, Jack. Thank you, and hello, everybody. I'm Luc. I will start that discussion today. We will have first a presentation where we have tried to summarize some points about the self-assessment and the local response. So our discussion today will be, our presentation today will be articulated around three, 4 moments. First, we will explain what is a self-assessment and the approach and how it was created. And secondly, we'll see what are the main lessons from the experience of the communities we are working with and the various team and organizations who have applied the approach, and how then Dr. Lamboray will speak about how we can use the tool of self-assessment, the self-assessment tool to face the COVID-19, and then there will be room for questions there. So let me start with a statement that which is guiding us in the constellation, is that we don't change people, but people change themselves. And the same statement is valid for communities as well. We don't change communities, and communities change themselves. But to change people and communities, there is a need for accompaniment. And this is basically what the constellation is doing, as we believe people and communities and groups have their inner strengths to face any challenges. So in that regard, sustainable changes in communities only happen if individuals are changing themselves. And there is an interaction between all these levels: individual, communities, support teams and facilitation teams, and at the macro level, policymakers and donors. There is a mutual support between those levels. All the changes that needs to be, all these changes that are happening and for which we are aiming at, they need to be nurtured, stimulated, and supported. This is what the constellation is doing through its methodology in order to achieve informed, competent, and resilient communities who mobilize their strengths to make measurable and verifiable progresses in the response to their priority issues. So the constellation, what it is about, as you can see on the slide there, it has been funded in 2005 to stimulate and support local response to HIV/AIDS initially. So the experience of the constellation is that in all parts of the world, communities have the capacity to respond to the challenge that they face. As a result of this insight, the constellation works with communities to stimulate local responses to challenges. It started with the HIV/AIDS and malaria. Over time, the methodology evolves, tackling a number of other issues, either medical or non-medical. In front of all these challenges, the main point for efficient and sustainable action is to stimulate ownership of the response by the communities and groups. And so what is the methodology about? So there is the first element of the community, of the methodology, is the SALT. The methodology used to stimulate local response include an approach, which is called SALT here, and which is summarized by this acronym, and which means stimulate, support, appreciate, listen, learn, link, transfer, and transform. And we have, with that, we have a process that we'll see on the next slide. In a nutshell, the SALT approach is a set of attitudes that facilitators develop and promote to create and animate spaces for dialogue with individuals and groups. It is a way of working, it is a way of interacting with people, and it is a DNA of the methodology. When we work with communities, we usually work with a group of committed individuals. This subset of the community is practicing and transferring the SALT CLCP to the entire community and beyond. And critical to that is a change in attitude of the people who are accompanying the community. The facilitators are addressing power relation hierarchy through the SALT approach itself. The attitude of the facilitator are critical throughout the process. So the process itself is summarized with this learning cycle that you have in front of you now. As I said before, the methodology has evolved and it was used to tackle a number of other issues. And realizing the power of the methodology there, we call now this entire process a community life competence process, with basically 8 steps. And all of them are implemented following the SALT approach as a way of working. This process is a learning cycle, and that can be and must be repeated extensively. It aims at bringing changes with individuals and within communities and groups. We don't have time to review all the steps today. What is important to understand is that the self-assessment that we are going to talk about belongs to that process and is usually performed at the step 4 here, and later at the step 7 of the process. It follows steps where individuals and groups are stimulated to reflect on their challenges and to build a common vision for the group with appropriate objectives and actions. At step 7, it follows implementation of an action plan. So here is just an example of a framework or the self-assessment tool that was developed some years ago, not for that current situation, but years ago. It's usually made up of a set of practices, around 10 to 15, that helps individuals and groups to change or strengthen attitudes and behaviors toward achievement of a defined vision or objective. These practices are based on a vision, we call it a dream usually, defined by the individual, the communities, or the groups themselves. Here is a self-assessment framework developed for human pandemic preparedness. General practices on the left column here. Here on the left column are the general practices, and then on the various boxes that you see here are in the column label 1, 2, 3, 4, 5 are summarized attitudes and actions that correspond to a given level of competence. They have been defined a priori in that case. That framework has been, as I said, that framework has been worked out for preparedness to a pandemic. That's why the proposed practices embed more than the personal transmission and care. The most important reason for a group to use such a framework is to stimulate discussions within its context about a current or expected challenge. In addition, it allows them to have a participatory recognition, assessment, or appropriation on the level of preparedness with regard to each practices. When we perform at the stage 4 of the process, as we saw before, such participatory assessment can be used as baseline status for the individual and communities and groups. A path. Now, how do we? What do mean the various level there? 1, 2, 3, 4, 5. As you can see on that slide, we for each practice, community members assess themselves at a level between 1 and 5. Level 1 indicates a low level of competence, and 5 indicates a high level of competence. As you can see here, for level 1, we know that we need to act, is a basic, but we know it's important, but we don't know how to do it. Here, we know how to do it, how to act, but we don't do it, in fact. At the level 3, we act sporadically, once in a while. And so, meaning that it's not well planned or regularly done. And at the level 4, we act systematically. It's art, but it follows a plan, or it follows some active participation, active involvement of people. And at the level 5, and this is the highest level, the action that the group or the individual or communities in general are undertaking, these actions have become natural, and people, they don't feel well usually if they don't do it. At each level of a practice, people must be able to describe here a fact, an action really happening in their context. A way to illustrate that a behavior or an attitude is really happening in the community there. Okay, we could. Then now I will leave the floor to Rituu to explain a little bit after this rapid overview of the self-assessment tool. To tell us, Rituu will tell us more about the experience of the Constellation communities vis-a-vis self-assessment. Rituu?
Yes, hi everyone. I'm calling from Delhi. I'm a facilitator of this approach, and I'm also an evaluation professional. With humility, I want to share some experiences and hope that I will also learn from you. What I've seen is that this process, step by step, this process which Luc shared earlier, starts building greater ownership of the people involved. We must remember that self-assessment is not community-led monitoring to hold institutions accountable. That could be part of it. But what it does is that it hands over to the group, organization, or community the power that we measure our own selves. And this instills a sense of responsibility that other players have a role to play, so do we have a responsibility and some actions we can take which others can't. And this is what stimulates this sense of responsibility, a behavior change and action. Another thing I've learned in my experience is that it brings together different actors in that particular project to jointly assess and also to listen to each other's perspective. And a safe space is created. And why I have realized this happens in self-assessment is because we have had steps of strength-based approach prior to this, realizing each other's strengths. Where do we all want to go? And that people realize that I have some strengths, and so do others have some strengths, and together we can achieve. And then people start thinking, what is our real situation here? What facts do we need to assess where we are? It prompts people also to look at what is the local data available. Do we need to collect more data? So this is not, I will say, a full-blown evaluation, but an assessment where people come together to see where we are and together what actions do we take. For instance, in COVID, what actions do we need to take for an effective response? Why I am also excited about this is that it brings an evaluative mindset in people, in communities, in groups, asking questions, critically thinking. Why is this happening? And also, it kind of makes it explicit to people when they are sitting together and taking action, the interconnectedness of issues. For instance, child health, they start realizing that for child health, vaccination, clean drinking water, physical health, mental health. So all these issues come through self-assessment because they develop different practices to achieve where they want to go. We all know in development sector, the local context is so important. And yeah, here it is not I sitting here in Delhi and preparing a self-assessment for a project with like multiple communities, 90 communities, but each group, each community developing their own self-assessment because the context, the issues, the strengths vary from group to group. These are some of my experiences, but I thought let me give you a glimpse of what happens in a self-assessment. Luc, please, could you move to the next slide? Yeah, so let me take you to a village. The slide before Luc, the one with the photograph, please.
Yeah,
this one.
This is it. This is all.
Yes. This is a village in northeast part of our country. Village surrounded by hills, paddy fields, and we were there on a hot, humid summer day in June. The topic of discussion was child health. And who was there? They were fathers, mothers, grandparents, young people, key people from the village, health workers, etc. We took a family-based and community-based approach on child health, often because such programs focus on women and they place onus on the woman for health of her children. And we wanted to instill that idea that everybody has a role to play in health of their children of that particular community. So we sparked off this discussion on the step which Luc spoke about is, where do you want to go? Where do you see yourself for health of your children? And several dreams came up, a common dream came, and then the community and this group developed practices, big actions they needed to take to achieve that dream. And I will share one practice out of it, which is they said that we want all children in our village to be vaccinated. And then they started assessing themselves what level they are. Most vocal people and most of them said, we are at level 4. Level 4 out of 5. We are really high because all children in our village are vaccinated. But then there was this health worker, she gets up and says, sorry, that's not true. My records show that there are these tribal population in the outskirts of the village. They rarely come for immunization. And also some parents come for immunization, some don't. And even if some come, they don't complete the schedule of immunization. And everyone looked at the mothers and the mothers said, we don't even know why we're taking our children for immunization. Everybody is taking, so we also take. And when we get the child immunized, the child has so many side effects that the husband says, why did you take the child for immunization? And also, sometimes we are overburdened with work and we don't have time. And the boys there, the young people said, so do you mean that the fathers have to take the children for immunization? That's not the role of the fathers. And that is the discussion started. And gradually they all realized that everybody has to participate. And we are not at level 4, but we are at slightly lower level at level 3. And that prompted them to take certain actions to move to that level 3, to level 4 in 6 months. In these communities, in this particular project, the 90 communities, they have done 3 self-assessments after about 7-8 months of gap. And initially they rated themselves, as I said, very high, but as they have become mature, they have realized that it's a self-measurement tool. And one person I heard from the community said, it's like the report card our children get from school. So we are able to see what we are able to achieve, what we are not able to achieve, and why and what kind of actions which have been result. Young people have been encouraging parents to take their children for immunization. Fathers and grandparents have started taking their children for immunization. Health workers don't have to remind their parents, please come for immunization. Yeah. So, but uh, each approach has its limitations. Here, the challenge has been uh, not all the people who did the first self-assessment come. It needs very strong facilitation skills. However, this approach builds very strong facilitation skills, so that the facilitators have been able to do very well. And also we have to go, as in all community-based approaches, we have to go by the pace of the community. Yeah, next slide, please, Luc. Okay, so as I said, I am a M&E professional, and while I was doing these evaluations, I used this approach by accident. So here I'm just sharing two examples. So the first example was first time I used this approach in evaluation. So there was this IDRC project where we had to involve sex workers in Cambodia and India um, in designing the evaluation. And also this project was a participatory action research project, and it had to be the sex workers had to lead this. So we did a very participatory workshop, problem-free stakeholder analysis. They enjoyed, we thought they enjoyed, but after that they came and they said, oh, it was very nice, but only PhDs and white people do evaluations and research. We can't do this. You take you take data from us, interview us, but we can't do this. We can't take the lead. And that is when I said, okay, why not try this approach? Because somewhere it builds that ownership. You know, everybody talks about these participatory tools, and it is making communities collect data for richer data for us, or are they collecting data for their use? This is a question I always ask myself. So, okay, and what happened here is that it worked really well, and they not only owned the design, but they gradually started owning the program. And here, 4 self-assessments were done, and you can read the paper which has been published. Similarly, for an evaluation in India with adolescent girls from like indigenous communities and from urban areas, we involve them in evaluation. And here what I learned is so important to create that safe space, and where people could be themselves, and where as a result of that ownership and using this in design of this midterm evaluation, they shared openly what worked, what did not work in the project, and felt that they were part of it. And we were not like, the evaluation team were not like auditors or interrogators who were there, but creating that space where they could also learn. Of course, we had an evaluation role to play, but definitely it strengthened the work we did. Yeah, Jean-Louis, over to you.
Jean-Louis? Jean-Louis, are you there?
Jean-Louis, I think you're self-muted. If you unmute your microphone, you should be able to take the lead here.
Jean-Louis?
There.
Yeah. The little, what is it, mic seemed to be a bit reluctant to open. Luc, could you please move straight to slide 16, please? So you, 16. Next one. Next one. Next one. Yes. So there we are. Most of us, probably most of you who are listening to us, are in some sort of confinement, quarantined, locked in their homes, or required just to move out to do errands and come back. So in that situation, how can we propose a self-assessment? You've heard most of the description that was there before. Is our experience is with communities discussing where they are at with a particular challenge so that they can achieve their dreams in life. And here we are with a situation where we cannot have meetings. We cannot do that. At the same time, all of us want to get out of confinement. We want to resume our lives. And we hear all kinds of ideas. The first one is, let's have a vaccine. That vaccine will come, God willing, in a year or two. Once that vaccine is there, there still needs to be financing and delivery methods. So that is one. The second one is herd immunity. Oh, let's have the people, the young people, those who have no disease and those who are younger than me, I'm 72, let them go out, have the infection, and then in the second stage, older people can go out. In Belgium, there is talk that such a strategy would take about 4 to 6 months. I'm not ready to stay home for 4 to 6 months. But there is a third form of immunity. That form of immunity is the social immunity. There is, if you want, a social vaccine. This is something we learned from AIDS. Some communities were more vulnerable to AIDS than others. Here we can see how the Western societies are quite vulnerable. This takes change of individual behavior, action in solidarity, and organization of collective action that is at the right path. Unfortunately, most of the time, the even development is being carried forward by government and health services, telling people what to do. That does not lead to the changes we require, not for COVID, not for any other issues such as climate change, etc. Next one, please. Luc, next one, please. Yes. Next one. Next one, please. Yeah. So we thought, let's start from an individual self-assessment. No, that's the one before, please. Let's start from an individual self-assessment whereby people, the one before, please, whereby people can think about their own situation, their own practices. In this case, there was no way. The next one on the practices, please. There was no way to actually go community by community and saying, what are the practices here you might deal with, you might have in order to deal with this issue. So we came up with 10 practices. They have now come to 12. These were built through consensus from all over the world. Europe, all continents were involved. Africa was involved heavily as well. So those, and I will just give an example. I did my own self-assessment. When I did that, I realized I was only level 2 on practice, or even level 1 on only touch my face to wash it. Or now we just, you say, I avoid touching my face. I touch my face all the time, and I don't know how to avoid doing that. Well, I discussed that with my wife in my family. Now she warns me every time I touch my face, which is very often. but I'm now getting conscious of it. I will slowly getting at a situation when I'm getting out of confinement. I take the bus or I in the train or I do errands. I'll be careful not to touch my face while I'm in an area where COVID might be on any object. This is just to give you an example on the individual. Yet, in the same example I give you, there, my wife is involved. So we propose, we penetrate in the families through the internet, through the use of the smartphones, so that people can use can reflect on their own situation together in a conversation with families. And in a second stage, with those who can, have a collective online discussions based on the self-assessment, but going beyond that. How can we help each other to make sure that the society we go in is not, once we get out of confinement, is not the society we go out, we came in with. This is quite important. The danger is that once confinement is finished, we go back to our old ways and maybe even worse. So therefore, the discussion on what type of society we want in the future is critical. And so this is what I would say. Last slide, please. These are examples. I just gave my own example. Just go to this invitation, no, the one with the link, please. Yes. So please, if you're interested, just take that one out. It is a very skimpy little website, but that goes to your own code check for coronavirus check, but also for conversation check. It is not just it is not a survey. The data are there for you to use in order to improve. Thank you very much.
Great, thank you very much, Jean-Louis. And with that, I think we're ready to move on to today's question and answer section. A couple of notes for you, for those of you online that have not been on a Thursday Talk before. You can submit a question in two ways. The first is through the question function on your GoToWebinar dashboard. I don't know why I'm struggling with the word webinar, considering I've hosted these for years. The second is to click on the hand icon, which will raise your hand and allow us to unmute your microphone so that you can ask your question live. When you do submit your question, we ask that you submit your name and affiliation. Just a note, these talks are recorded and posted on Demon for Pieces Media Gallery, so those who are not able to join us at this time can go back and listen to today's discussion. And given the fact that we have 3 experts and 3 guests this week, if you have a targeted question, please make sure to write who your question is targeted at in when you type the question. Okay, the first question I have comes from Alex Carter, and Alex Carter has directed his question at Rituu. Rituu, do you have tips for creating a safe space with equal participation, avoiding traditional hierarchies in communities?
Alex, yeah, I think other teammates can add, but it's the SALT approach is which gives energy to this process, is appreciative, deep listening to learn as a human being, connecting people as a human being. I think for me is the first, is the most powerful tip I can give you, Alex.
Great. Jean-Louis, Luc, do you have anything you'd like to add?
No. I think not from my point.
Okay, great. Okay, let's just one very simple thing. It is just a setting. We will never have our meetings in classroom or other settings with high tables. It's always circle.
Interesting. And you're saying that the circle is just to facilitate sort of a more cohesive more horizontal approach?
That is correct. Even if you have high-level authorities, etc., we are all human. So we don't start with a round of titles and etc. We start with first names, and we try to avoid anything that is implying hierarchy.
That's really interesting. Our next question comes from Abigail Leadbeater. And Abigail writes, how can we facilitate individuals to self-assess from afar, especially in areas with low literacy or education?
Jean-Louis, do you want to answer that?
The first thing is that we observe that there is always a link person. So if you want, the collective self-assessment is in general or always done at the invitation of someone from the community. So that is the first. So it can be very far. We were invited in the high mountains of Papua New Guinea. People could not count, could count, but were illiterate, and they would do their self-assessment moving stones from one pole to another to say, this is where we are. So it always can be done. Now, if the question relates to the self-assessment around COVID, the idea is indeed that some people who have some technological means can receive the self-assessment and the method, and then move on their own. Time is of the essence here. That's why we choose that instead of a slower method that would go step by step, if you want, in every single community. Vis-a-vis COVID, we don't have that time.
Great, thank you, Jean-Louis. Our next question comes from Jude Amondi, and Jude is based in Uganda. Jude writes, are there any challenges related to the communities with low uptake or little coverage of smartphones that you've encountered? How did you address that?
I suppose this question goes about, because we talked about smartphones, and yes, we do have a last mile issue. Clearly, the self-assessment can be printed, put on a motorbike, and be discussed with others. What we see is that there is, we witness that all the time. When people see the value of a particular approach, they find by themselves the way to share that approach to other communities. We call this, we witness, and we have witnessed that in the context of AIDS, for instance, that is that there is horizontal transfer or spontaneous transfer. People will transfer spontaneously if they see value of what they are learning with their own community. So we count on that, basically, for people to say, this is too important, let me share this with my brothers who have no internet connection. In the same context that was in Papua, in Indonesia, people walked from Indonesia, the Papua, to PNG to share this approach with their people. And so we count, if you want, on a positive epidemic of response towards COVID, as we have seen people responding to other pandemics before.
I guess a question I have, and maybe this question goes to all three of you really, is one of the challenges you often see with self-assessment is people filling in their information incorrectly. You know, people write the answers they want to see, or they think that the person collecting the data wants to see, as opposed to actually what was a truthful response. How do you guys deal with that bias? Like, we know self-assessments can be skewed. How do you overcome that challenge?
If I may, I think Rituu mentioned that the fact that in the first self-assessment done with communities and groups, there was generally a high scoring of the within the on the 5-level scale, and to counter a little bit this what you mentioned there, we usually request people, I mean, through the facilitator himself or herself, I mean, the person leading the discussion there is requesting and looking for facts and for things which are illustrating the level where they think they are. And if we have a broad representation, a group where different type of people, as we usually manage to have, sometimes it creates some interesting discussion where people do not agree or mention some facts which demonstrate or do not demonstrate or the level of the practice there. The idea is to rely on what's happening really in the community, what's happening with individual there, and either being a general fact shared by all the people there, or with a majority of people. Sometimes when we had that such a problem where people were reasoning by a kind of what they would like to see in the community compared to what is really happening, then this is because people do not realize that really the difference between the real fact and the hope or what I call the opinion per se. So insisting on the illustration with real facts, and where all people in the group can say, yes, it's happening, this is happening in our group, in our communities, having a kind of consensus around something happening there, then we manage this bias.
Luc, thank you very much. Unfortunately, we are at time today. Time flies when you're having fun. Thank you, Luc, Rituu, and Jean-Louis, for a wonderful presentation and discussion. And thank you to our audience, who a lot of new faces today. So I look forward to seeing you again in the not too distant future. A couple of announcements for you all before we close out today's webinar. The first, and if I had sound effects, right now I'd be playing a drum roll. So drum roll, please. I'm excited to announce that DME for Peace are launching a new initiative in the wake of COVID-19, and that is Connections. Connections will allow peace builders around the world to digitally connect with other practitioners, develop working relationships, and have real conversations about their work through this period of isolation. You know, Connections and the Connections initiative is inspired by DME for Peace's commitment to supporting our community, and not only providing connection to resources and emerging best practices, but also providing connection opportunities between practitioners working on similar issues in a variety of contexts. We are a living, learning community, and Connections will allow peace builders to digitally connect with other practitioners and really work through this period of isolation. If you are interested in learning more, I have put the link in the web page in your chat boxes right now. And if you're interested in partnering with us on a similar initiative, or you want to help us scale up these kinds of initiatives, please feel free to contact me directly. I've also included my email in this chat box. You guys have got a sneak peek of this initiative, because we're going to be announcing this to the entire DME for Peace community and evaluation community in about 15 minutes time via our email. The second thing I want to ask of you today is, once you end today's webinar, you're going to be able to click X and close, and you're going to be greeted with a survey question. We want to know where you're joining today's webinar from. If you could fill this in with your country and city, that would be great. Thank you again to everyone for joining today's webinar. This recording will be posted online on our media gallery later today, so please feel free to return to it, share it with your colleagues, and continue the discussion in the comments. We'll be back next week with members of the Talking Drum Studio and Search for Common Ground to discuss some of the lessons learned from Ebola in Liberia and Sierra Leone and how they could potentially be applied to coronavirus. I'm really looking forward to that discussion. I hope to see you all there. As I said last time, this is a very difficult time for us all. Please look out for each other. Please take care and please stay healthy.
Thank you very much, Jacques. Thank you, everybody.